Today hosts the African Health Professional Regulatory Collaborative, the ARC, for Nurses and Midwives Summit of Congress here in Windhoek. The ARC is a partnership in which national nursing and midwifery teams together to improve the professional regulations in the East, Central and Southern African regions. The aim is to help break down silos between professional institutions within country and thus empower national level leadership to come together to own and lead improvements to nursing and midwifery, amongst others. Joining us is Dr. Patricia Riley from the CDC in Atlanta. One doctor.
Good morning. Actually, I'm a nurse midwife, but I am the team lead for health systems and program integration at the CDC in Atlanta.
Okay. Let's talk about, just I think from your understanding, what is the need for the ARC?
Okay. So let me first clarify to say that the ARC is funded by the President's Emergency Plan for AIDS Relief, PEPFAR. So the whole intent is really to capacitate nurses and midwives in their ability to deliver antiretroviral therapy and provide care and services to HIV-positive patients in the region.
How has Namibia been implementing? And, you know, we kind of want to find out about our status. Where is it? How do we contextualize it in order to understand the objectives of the Congress in the Namibian context?
Right. Well, a key aspect for nurse and midwifery in the 21st century, and now with the added resources that we have for managing ART, is to increase the practice of nurses and midwives in the management of patient care. And Namibia, similar to South Africa in many respects, has been at the forefront in increasing the responsibility for nurses and midwives to initiate and manage ART. And you know, the PEPFAR program has focused on not only increasing services to individuals who are HIV, but we're also looking at reducing and eliminating the transmission of HIV from HIV-positive women to their newborn child, and also managing the care of HIV-positive children. So this is requiring expanded skill sets, clinical diagnostic awareness among nurses that maybe 10 years ago weren't part of their training or curriculum. So part of our effort here is to ensure that not only is the educational components there, but they're also the regulatory aspects that enable nurses to engage in what we call task sharing, where nurses practice in places where maybe 10 years ago it was the sole purview of a physician.
Okay, so what we're talking about in terms of, firstly, I think the regulatory framework, what type of a regulatory, enabling regulatory framework is required for your function to be optimal?
Right, well, the very first thing would be to have permissive legislative authority. In other words, there are some countries actually which very specifically state that only a clinical officer or medical doctor can prescribe or initiate antiretroviral therapy. So the first aspect is, do you have the legislation in place? Namibia does. Are there defined scopes of practice that would determine what a nurse or provider, a nurse midwife provider would offer? And that is in place here. The reason that's important is you don't want nurses ad hoc to begin providing care without the protection of regulations, scopes of practice, an understanding by the Ministry of Health that this falls within their domain of service.
What has the responses been from the nurses?
The nursing leaders, for the most part, have been very positive. Now, I have to tell you, 2 years ago, we conducted a survey among 15 of our 17 participating countries. And there were several countries where, at that time, they had not fully, the laws and regulation had not embraced full task sharing among the nurses and midwives. Since then, up until now, we only have one country that has still resisted, but we are hopeful that by the end of 2015, 2016, the laws will be changed and there will be recognition that nurses and midwives can in fact be full-fledged players in providing antiretroviral services.
What gaps, increasingly, if we have more nurses that are fulfilling this function, what gaps are they filling? What gaps exist currently that will be filled through this intervention?
Well, let me just say that for all of the countries that are participating in our collaborative, they are all what the World Health Organization would call as human resource challenged countries. In other words, WHO has identified that you need 2.3 doctors, nurses, or midwives per 1,000 population in order to maintain health. Namibia is just above that level. So among the countries that show a health provider disparity, Namibia is at the higher end, but still is seen as certainly below what we would want. And among your health providers, your largest cadre are your nurses and midwives. You don't have enough physicians in place to provide that care. So if we don't extend and recognize nurses and midwives as key providers in these services, you're not going to be able to receive the full coverage that is intended with the PEPFAR initiative, and that I'm sure your Ministry of Health would want.
In terms of, the biggest criticism is usually a lack of, shortage in health professionals, and so this is filling up that human capital gap. Let's talk a little bit about the conference that's taking place.
Yes.
It's over 12 sub-Saharan African countries will be participating.
17 teams.
Oh, wow.
17 teams.
That's very interesting. Tell us, what can we expect, and what are the intended outcomes from the Congress?
Right. Well, of the teams that are presenting, that are attending, about 11 of them were given mini awards to execute a regulatory project. So what we're looking for with this conference is to see what were the nurses able to accomplish over the past 12 months. We convene this meeting every year, and we make these awards every year to the most competitive awards. Namibia has received one of these awards, and their focus has been on continuing professional development and assessing that aspect for the nurses and midwives. So they evaluated this activity specific to preventing mother-to-child transmission of HIV. PMTCT, correct. So they are going to be reporting out on their findings. So we expect to see south-to-south sharing, identification of best practices, and there's also some new updates around viral load testing for clinicians, which is going to be increasingly a valuable component of managing ART and HIV patients, and also pediatric AIDS. There's going to be some updates, and Namibia has done a very good, has made much progress in management of pediatric HIV here.
And the last question is going to be a little challenging in the aspect of, in the public perception at least, sometimes nurses seem to be overwhelmed by, the level of demand already, just not considering, them being able to provide ART as a provision. Is this true? Does it further overwhelm nurses? Does it, expand their mandate to the point where it thins them out and they're not able to then function optimally within maybe the acute cases that they're currently handling?
Well, that's a good question. And the whole concept around task sharing is that we work now as a team. So it's not that we're piling on more responsibilities with nurses without recognizing that they also look at their portfolio of tasks and see which among those tasks could be shared to perhaps maybe a community health worker or another healthcare provider. But really, how nurses are functioning now is not the same as how we functioned 10 years ago. Yes. We're in the 21st century, and this whole conference is intended to orient nurses to a new direction, to empower them to step up to the plate and, see their role as key players in providing health services. And then that means revisiting which aspects of what they do are critical for maintaining the health and welfare of the people in their respective countries.
So what you're saying is that you're not itemizing the functions of nurses, but it's more collaborative.
It's a collaborative team,
and
correct.
Correct. Then why is it need, I think increasingly throughout various sectors, we're finding that people are taking this more collaborative approach and not itemizing people and letting them function in isolation. Why is this approach necessary, and how is it effective?
Well, because it enhances communication. When we see a patient, and if we only manage them in silos, for example, if the laboratorian only provides their test to a physician who has limited access to the patient, the person who's seeing the patient then is unable to provide the very best care. So the teamwork facilitates communication. And it's not just communication among the healthcare providers, but also the patient, because we want the patient also to own their health and to be a partner in the direction of their health services that they receive. So it's a different paradigm that we're trying to introduce with this Congress, and that we've been working now. This is our 4th year of pulling these teams together and really introducing these concepts to these lead nurses in each of these 17 countries.
Any final remarks?
This is my first time coming to Namibia. It's a pleasure to be here, and the first time we've held this Congress here, and I am looking forward to it, and I appreciate the warm welcome we've received so far.
Well, thank you, Doctor.
Thank you so much.
And all the best in your endeavors.
Thank you so much.
Thank you. Joining us there is Dr. Patricia Riley. That's actually here for the conference that's taking place on the African Health Professional Regulatory Collaborative Framework. It's a new initiative that makes nurses function together in teams so that they're able to provide ART, that is antiretroviral treatment, to patients that might be either infected with HIV or for mothers when they are transmitting it to their kids. I think interesting stuff happening there in the health sector. For more on this, stay tuned to GMN.